Hello everyone, and welcome to Signa Collaborative Solutions for Plastic Pollution. Just a few reminders, please keep your microphones muted and use this Zoom chat to introduce yourself, your organization, and your country. Okay, you can see on the group on the chat on how you will rename yourselves. So again, good morning, good evening, and welcome to Signa, our webinar. And thank you for joining us from Southeast Asia, South Asia, East Asia, Europe, Africa, and the Americas. Plastics are deeply embedded in healthcare, from packaging, medical devices to personal protective equipment and textiles. At the same time, plastic pollution is a public health and environmental health challenge that requires a tailored, health-centered action. The word Signa, the title of our webinar, is part of a medical prescription for health professionals. We know Signa as literally meaning instruction, which provides instruction for use for the patient who are using the prescription. For today's webinar, it represents a collective prescription for action, what healthcare institutions, policymakers, procurement people, and partners should do differently to prevent plastic-related harm across the life cycle. Our session will introduce Healthcare Without Harm's plastics work and invite participants to share their own prescription for plastic pollution and we will also present the healthcare plastics decision-making framework and highlight a case study on reusable textiles. So before we start with our speakers, we invite everyone to engage in this interactive session. So please, everyone, participate in a short reflection since this is our opportunity to share how we encounter plastic pollution and the solutions you believe should be prioritized. Let me introduce Kyla, our Climate and Health Officer, for an interactive session. Kyla, the mic is yours.
Hello, everybody. Good morning and good evening. Thank you, Michelle. So to everybody, thank you for spending your evenings, your mornings with us to discuss Plastic Free July. Before anything else, I want to hear from you. So please utilize our chat box. Please let me know where you guys are from. I see a lot saying from. Let me go look at the chat box. We have people here from the Philippines. Do we have other participants coming from other countries? I know somebody's here from Brazil. Thank you for joining us. From India. Okay, so you can utilize our chat box. Hello from Singapore. From the United States. More from Singapore. Perfect. Thank you for spending your evenings and your mornings here with us. So, now that you got familiarized with the chat box, I'd like also to ask you guys a few questions. So, sorry, I'm just gonna, okay. So, if you can, please also use the chat box to let us know what plastic item do you commonly see in your workplace or your community that you think should be reduced, redesigned, reused, replaced, or better managed. So, is it something like plastic bags from the groceries? Is it something like plastic packaging that you see around the hospital? I see packaging. Other than packaging, do we have other answers? We have utensils as well. So I'll give you around like 60 more seconds. You can drop your answers in the chat box. So what else are plastic used in your workplace or in your community? So please let us know, and something that you think should be reduced, redesigned, reused, replaced, or should be better managed. Okay, last 20 seconds. Okay, thank you everybody for your answers. Let's quickly go through them. I see a lot. There a lot of people saying food packaging, utensils as well, gloves, food sachets, so water bottles as well. So a lot of it in the food sector. Somebody mentioned PET bottles, plastic packaging, tarpaulin, medical use plastics, syringe as well. So these are also wrappers found in the medical system. Clinical waste, takeaway containers, blood bags, unnecessary transfusions. So this happens. Thank you for engaging in this first question. Next, I want to hear from you. Please complete this sentence. My prescription for plastic pollution is to. So you're gonna link what you answered earlier and in your space, in your capacity, what you think can do to address plastic pollution. So I want to hear your answers. Please, I'm going to give you also around 60 seconds to think of your answers and to jot it down in the chat box. So my prescription for plastic pollution is to. Okay, I'm going to start reading it in a few seconds. Okay, last 20 seconds, everybody. You should start typing a little faster. So think, my prescription for plastic pollution is to. Others said reduce their actual use of plastics, to avoid their use as well, to minimize food wraps and switch to biodegradable wraps. A lot said reduce, to minimize, and to remove entirely plastic packaging in the food. So that's good as well. Communicate to suppliers our criteria to phase out the most toxic plastic products. To redesign the supply chain by using the 3 R's: reduce, reusing, and recycling, while also balancing the business needs of the health group, to advocate to policymakers to ban single-use plastics in the healthcare facility. My prescription for plastic pollution is to minimizing use. Patient blood management, to use stricter laws as well, to avoid plastic, to bring your own utensils, reduce, reuse, recycle, and rethink, and also to educate my patients. I really like the diverse set of answers that you've given. It also shows the importance of tackling plastic waste through the bottom up approach and the top down approach, where everybody, the whole society, has to work hand in hand to tackle this problem. So thank you everybody that contributed. Your responses demonstrate actually that plastic reduction requires action across the design, procurement, clinical practice, waste management, and policy. We now move to a more practical framework that can help healthcare institutions prioritize plastics for action. So we hope that you enjoy the rest of your evenings and mornings with us. Michelle, back to you.
Thank you, Kyla, and to those who shared their prescription. That was a very fun and engaging session, and we hope that you keep that energy throughout the webinar. So, for the next session, healthcare has a distinctive plastic use pattern shaped by either patient safety, infection prevention, regulatory requirements, and market availability. These considerations make prioritization essential but not impossible. So, to introduce what Healthcare Without Harm has been doing in our plastics pillar and the methodology for identifying and prioritizing plastics for action, please help me welcome Stacia Clinton, the Senior Project Lead for the Global Plastics Treaty in Healthcare Without Harm. Hi, Stacia, and the mic is yours.
Thanks so much, Michelle. I am so happy to be here. I'm joined with my Healthcare Without Harm Southeast Asia colleagues. You can move to the next slide. So I'm planning to share about the momentous progress and continued opportunity of the healthcare sector action on plastics. I'm going to provide an overview of our global initiative titled The Cure for Plastics Dependency, and then I will dig into the details of a critical new resource to define and prioritize problematic and avoidable plastics. So let's move to the next slide. So, for those who are less familiar, Healthcare Without Harm and our regional partners throughout the world support a network of over 70,000 hospitals and health facilities across 88 countries through our Global Green and Healthy Hospitals network. And in addition, we have a vast network of health professionals that have underpinned some amazing progress on plastic and toxic chemical reduction, as well as activated their voices in critical policy. For example, over 48 million health professionals voiced support for health-focused global plastics treaty. Next slide, please. So just to share some details on our global strategy, we work across 5 interrelated areas. We help to collate available science and contribute to original research in order to guide the sector to act on reducing or eliminating the most problematic or avoidable plastics. So I'm going to share a bit more about our new methodology in just a moment. We also provide tools and resources to assist hospitals in building best practice and understanding the human impact of reducing plastic pollution and hazardous chemical exposure. We engage supply chain leaders and we bring them to multi-stakeholder tables where we aim to address common barriers and we stimulate innovation for safer alternatives. And all of this work, including the collating of the tangible volume reductions and cost savings of progress underway, is elevated to inform policy that address these barriers and also to create safer products and solutions in the healthcare sector and beyond. So a lot of this work, for instance, is elevated in national policy level and also in global opportunities such as the Global Plastics Treaty and the Global Framework on Chemicals. And then finally, our network, our collaborative relationships, and our convenings, such as this, align and reinforce a shared aim for placing human and environmental health at the center of decisions about what is made. So if you move to the next slide, really, there we go. Yeah, really, this slide is just a snapshot of some of the incredible work and the impact that this network has had. For example, one initiative of just 8 hospitals eliminated over 100,000 plastic devices in 1 year alone. One hospital network in Canada saved over 6.3 million Canadian dollars over a multi-year effort. And then through Healthcare Without Harm's flagship initiative, Born Green Generation, 38,000 babies have been born or treated with lower plastic care, reducing their exposure to the related plastic chemicals. So this is just knowing that this is a snapshot. There's a tremendous amount of opportunity and continued work ahead as we all collectively work to tackle plastics pollution upstream. So why don't we move on to the next slide? And what I'd like to do is dig into more detail about a key resource that we released just today. So it's hot off the press. I'm going to be talking about a methodology for defining problematic and avoidable plastics. The creation of this methodology was developed in response to an identified need by hospitals and our partners doing the work. The resource went through numerous rounds of consultation across our global network and with partner organizations and intergovernmental entities. And all agreed, the reality is that plastics are ubiquitous. Oh, do we have a problem with the slides? I'll keep going and hopefully the slides will work themselves out. So the reality is that, all agreed. Oh, previous slide. Uh, Plastics are ubiquitous in healthcare and they bring significant health, environmental, and climate impacts across their life cycle, from production through use and disposal. And if possible, to move back to the previous slide. There we go. That's great. Plastics can contain chemicals of concern, and healthcare is a particularly important setting because patients and healthcare workers may be exposed to those chemicals during product use. Some of the people receiving care may also be particularly vulnerable to these exposures. I was just talking about sort of the opportunity around maternal and child health. At the same time, healthcare presents some particular challenges. Select plastic products may have important clinical functions. We have infection prevention requirements, regulatory constraints, markets in which healthcare providers don't always have as much choice as they may like to around the products available to them. So there is a clear need for action on plastics in healthcare, but we also need to think carefully about how to prioritize that action. And so you can move on to the next slide. So we want to overall reduce the health and environmental impact of plastics in healthcare. The challenge is moving from that broad goal to decisions about what to do. Healthcare uses such a large number of plastic products across very different clinical contexts. And hospitals are asking us which products and uses should we prioritize? What kinds of actions should we take? And, which of those actions are actually feasible in different healthcare settings. So these are all sort of related questions, but they're not exactly the same. Identifying a problematic plastic doesn't necessarily tell us what the best intervention is. And similarly, identifying a desirable intervention doesn't necessarily mean it can immediately be implemented in every healthcare setting. I'm probably not sharing anything that those of you working in healthcare don't already know. So what really was needed was a structured way to move through those decisions, from identifying where action is most important based around the science and evidence, to determining what action makes sense, to considering how that action can actually be implemented in your region or setting. So that is the essential purpose of the methodology that we're presenting here. So moving on to the next slide. So in developing this resource, we didn't start from scratch. It builds on 3 existing approaches. First, we draw on the Nordic Council of Ministers' global criteria for identifying problematic and avoidable plastics across all sectors. And these provide the starting point for asking which products and uses warrant concern. Second, we use the waste hierarchy to move from identifying a problem to considering what to do about it. So prioritizing elimination and reduction where possible, followed by reuse and safer substitution. And third, we drew on something called PASSUP, the pragmatic approach to streamlining single-use plastics. This is a framework that was developed through an intersectional consensus process and provides a way of assessing potential conflicts with safety, effectiveness, and affordability in the healthcare setting. So our methodology brings these approaches together into a single decision-making process and then adapts and extends them for healthcare in particular. So next slide. So the resulting methodology moves through 3 steps that mimic sort of what I was sharing. So the first step is identifying products and related uses as either problematic and or avoidable. We start with the Nordic Council criteria, but add additional considerations that are particularly important in the healthcare setting, including things like patient and worker exposure, clinical function and necessity, infection prevention, and regulatory and safety constraints. So moving on to step 2, we define the action by applying the waste hierarchy. The aim, as I mentioned, is really to address the impacts as far upstream as possible. So eliminating unnecessary use, reducing material use, moving to reuse where it's safe and feasible, are some examples. And then step 3 is to refine those actions. We use PASSUP as a feasibility feature or filter, but add local and regional considerations that may determine whether and how an intervention can actually be implemented in your environment, in your local community. These include the availability of our alternatives, the regulatory environment that you're facing, compatibility with existing systems, infrastructure, economics, and user and clinical acceptance. So, an important point, however, is that these implementation constraints should not and don't change the underlying need for action. They are instead, they may change the pathway or the timeline for action. So, for example, pointing towards things like supplier engagement or infrastructure development, conducting a pilot to try something out first, or even pursuing advocacy for a policy change rather than being able to make immediate substitution. And the key here is that you don't stop with the barriers, but you explore opportunities for action, acknowledging those barriers. Okay, moving to the next slide. So ultimately, the purpose of this methodology is really to help focus action. Healthcare uses so many different plastic products, and the healthcare systems are often challenged with figuring out how to tackle everything. The framework can help identify opportunities where action has the potential to produce meaningful health and environmental benefits. Higher priority is often given to higher volume products or products associated with known or suspected chemical hazards. Maybe those that are have direct or prolonged patient or worker exposure, and products used in critical application or with particularly vulnerable populations. Those are all areas that can zero in to help focus your attention. And we also look for opportunities where action is possible now. For example, where safer alternatives are available or where changes in practice could reduce plastic use. So the goal is to move from the very large problem of plastics in healthcare to a structured way of deciding where to focus, what action to take, and how to move that action forward. So I'll move to the final slide here. And I just want to put in context the methodology of the larger body of work and global strategy that I shared. So this decision-making framework is one of three complementary resources that we want to use to empower healthcare to take action. It provides the underlying methodology, the logic for identifying and prioritizing problematic and avoidable plastics, and guiding how to determine appropriate actions. That methodology is informing a forthcoming resource on our action priorities, which will identify a more focused set of products, polymers, and clinical pathways for global network action. And that's an opportunity for multi-regions to work on similar products or interventions and learn from each other to accelerate progress in those core areas at a time. And the third resource will translate the methodology into a practical implementation guide that health facilities can use in their settings and across and access through the Global Green and Healthy Hospitals Network. So, in closing, the framework we're presenting here is really intended as the foundation, moving from that broad problem of plastics in healthcare to priorities for action. And as we move through the development of these additional resources, ultimately to guiding implementation. And I am certain that you will find some value in exploring this original methodology. So thank you so much for having me here today. And I'm going to pass it back over to Michelle.
Thank you, Stacia, for presenting a structured approach that can support evidence-based decisions and meaningful plastics reduction in the health sector. We will now look at how collaborative action can translate into practice through a case study on reusable medical textiles. Let me introduce Murilo, who is an environmental specialist from Signa. Murilo, the mic is yours.
Thank you, Michelle. Good morning, good afternoon, and good evening. That's my case, everyone. My name is Murilo, environmental specialist at Signa in Brazil. It's a true privilege to be here with you today at the Signa webinar. I'd like to begin by expressing my heartfelt gratitude for this invitation. With a special thank you to Alessandra Azevedo and to the Health Hospitals Project now in Brazil. To their incredible leadership and support. Today, I'm honored to share our experience in a presentation entitled Case Study on Reusable Textiles, Replacing Single-Use Plastics and Driving Circular Solutions in Healthcare in Brazil. Before we dive into the project itself, let me introduce you to the organization behind this initiative. Next slide, please. To give you some background, CEJAN, the Dr. João Amorim Center for Studies and Research, is a non-profit healthcare organization with a 35-year legacy supporting Brazil's public health system, now as SUS. Today, CEJAN manages over 100 health units across 19 municipalities in the states of São Paulo and Rio de Janeiro, range from primary care health centers to highlight complex public hospitals. Powered by dedicated team of over 25,000 healthcare professionals and support staff. Our daily mission is to combine high-quality patient care with strong environmental stewardship. Next, please. Next slide. Oh, thank you. So, in what contest were we invited to join this initiative? Over the past years, CEJAN has consolidated a robust environment and climate responsibility agenda under our ESG framework. Back in 2023, we published a formal public commitment to combat plastic pollution across our facilities. Because of this activity commented in October 2024, we were invited by Health Hospitals Project, the strategic partner of Healthcare Without Harm in Brazil, to enjoy the Global Reusable Textiles Initiative. Other than testing this solution in a single isolated hospital, CEJAN decided to accept a much larger operational challenge, scaling the pilot project across an entire healthcare hospitals network of 8 public hospitals and 2 outpatient clinics. As well, all know, it's hardly necessary to remind this audience of the paramount role that environment protection and climate action play in global health systems today. Protecting public health indirectly requires protecting the planet that sustains us. Next, please. To execute a project of this magnitude, how did implementation actually take place? We structure our methodology around three core sequential steps. First, governance. We established corporate and local task force formed by 31 multidisciplinary representatives from procurement, nursing, central sterile supply department, infection control, laundry service, and environmental, social, and governance teams, holding 29 collaborative sessions. Our team completed online training models using the method provided by the Global Project. Second, audits and tooling. Applying Healthcare Without Harm's medical textile tool, our teams conducted rigorous physical on-site audits in high-demand units, such as operation rooms, intensive care units, emergency departments, and outpatient clinics. Third, waste diagnosis. The audit revealed an estimated baseline generation of 112 tons per year of single-use plastic textile waste. From this, we prioritized for key products: surgical gowns, sterilization wraps, surgical caps, and shoe covers, which together account for an estimated 62% of this plastic waste stream. Next, please. Move on to our initial results and expected impact. As an immediate result, starting in January 2026, we achieve a 100% elimination of single-use disposable shoe covers through clinical protocols updates and staff education. Transitioning surgical guns began in February 2026, targeting 6% of our plastic waste stream. Overall, we are on track to prevent approximated 69,000 kilograms of plastic waste annually by late 2026. Of course, driving circular solutions in public healthcare comes with key challenges. Managing this transition involves turnover in project monitoring. Monitor teams require continuous staff engagement. Furthermore, we encourage operation bottlenecks with third-party laundry service providers, particularly in Rio de Janeiro, regarding process capacity, logistics, and technical wash standards. To address these hurdles, we are launching a low-complex unit pilot for sterilization reps, updating corporate procurement guidelines, training suppliers, and tracking a 50-wash life cycle metric. Next, please. As a part of preparing this presentation, we pulled the first semester purchasing data for surgical gowns in two of our hospitals, which reveals two distinct operation realities. In Hospital 1, we achieved an 82.5% reduction, but in Hospital 2, first case represent a 64.9% increase. However, dry kicking conclusions find these contracts results highlighted in an important next step. Our team is currently investigating then scenarios root cause. We are analyzing for key variables. First, product specifics, identifying which specific gown types experienced purchase shifts. Second, laundry operation impact, evaluation vendor processing capacity and quality performance. Third, clinical demand, tracking fluctuations in surgical procedures and care volume. And fourth, stock dynamics, reviewing baseline safety stock adjustments and inventory build-up. The last one, this data-driven investigation will help us refine our circular strategy across our units. In conclusion, replacing single-use items with reusable textiles require continuous learning, but patient safety, operation excellence, and environmental stewardship can and must go hand in hand. Thank you very much.
Thank you, Murilo, for that presentation. And just to provide you all context, Sejam was part of one of the few hospitals who piloted the reusable textiles project, including Europe and the Philippines. So reusable systems can help healthcare institutions reduce dependence on disposable products such as textiles, as shown by Murillo in Sejam as a case study. And thank you, Murillo, for demonstrating how healthcare facilities can move from intention to implementation through practical and collaborative solution. So for the next part of the session, this is the one of the most exciting and highlight part is we are launching a short video that connects the issue of plastic pollution to the realities of healthcare delivery. So behind the scalpel video draws attention to the often hidden environmental and health impacts associated with plastic use in healthcare. The video invites us to consider how the health sector can continue protecting patients while preventing harm across the plastic life cycle. So we now invite you to watch the official Behind the Scalpel video.
One moment, please, Doc Mitch.
Thank you.
Every day, hospitals save lives. From routine care to life-saving surgeries, healthcare workers rely on essential medical supplies to protect patients. These materials make modern healthcare possible. But behind every act of care is an often unseen environmental footprint.
Most of the supplies we use are single-use items. They are essential in infection prevention and patient safety. But it also generates a huge amount of waste here in the hospital every day. In fact, during our waste audit in 2024, most of our waste are actually plastics.
In operating rooms and clinical areas, single-use plastics are deeply embedded in healthcare practice. Once discarded, healthcare plastics enter complex waste systems that must balance safety, compliance, and environmental responsibility.
Proper waste disposal is very critical in our hospital operation. In our facility, we have been doing waste segregation and waste tagging. These two are very important as segregation categorizes the waste and waste tagging identifies where the waste comes from.
But the challenge begins long before disposal. It starts with the materials we use. Beyond increasing healthcare's contribution to plastic pollution, plastics can also pose significant risks to human health.
Plastic pollution is not only an environmental issue, it is a human health issue. In many research, microplastic has been detected in our blood, in our lungs, and even in the placenta. This raises concerns with the potential link to inflammation, hormonal disruption, and other health risks and diseases. But on a brighter note, I'm very hopeful and encouraged to see healthcare leaders taking action and helping drive solutions to this fast-growing environmental health challenge.
Across healthcare systems, the shift towards sustainability is already underway. Hospitals are beginning to move beyond waste management alone toward systemic solutions, such as redesigning procurement, adopting reusable, safer alternatives, and establishing clear policies that reduce unnecessary plastic use to protect both patient safety and environmental health without compromising quality of care.
There are already practical solutions that hospitals can implement, as proven by our Global Green and Healthy Hospitals network. Hospitals are already replacing single-use PPEs with reusable medical textiles, conducting waste audit, and implementing policies that phase out the most problematic single-use plastics while strengthening zero-waste principles and reuse systems.
Bilang miyembro ng GGHH, patuloy kami sa paghahanap ng paraan para ma-improve ang sustainability ng aming ospital. Sisikapit namin na mabawasan pa ang mga plastic na ginagamit sa aming ospital.
We need a strong, legally binding global plastics treaty to end plastic pollution, one that puts human health at its core and avoids blanket exemptions for the healthcare sector. Health considerations must be embedded throughout the treaty to prevent plastic-related harm to people and the planet. Let's eliminate problematic and avoidable plastics and ensure that plastics in healthcare are safe, non-toxic, non-polluting, and supportive of human health, climate resilience, and environmental sustainability. Protecting health means protecting the environment we all depend on. This is our prescription for change.
Wow, that was a really great video, which served as a reminder that the healthcare's mission, first do no harm, to heal must also include protecting communities and the environment from the preventable plastic pollution and its harm to human health, the environment, and even to animal health. So, today's webinar has offered a collective prescription for action. We heard that meaningful plastic reduction in healthcare is possible when institutions use clear prioritization methods and strengthen procurement and policy and collaborate with suppliers and partners and learn from practical solutions such as reusable textiles. So let me just quickly share to you all. Hold on. Let me just quickly share to you my slide just to provide you a quick okay. So for the past few days during the Plastics Free July, no, we did a launch and press conference. So our theme actually for the entire Plastics Free July is One Health Prescription and to address plastic pollution. Wherein this is where we also launched the Behind the Scalpel art installation. During that event as well, we had a press conference wherein medical leaders from medical organizations signed the letter of commitment, which is entitled Southeast Asian Health Professionals Statement of Commitment and Prescription to Address Plastic Pollution in Healthcare. Now, we have an ongoing studies and safe case studies regarding the impacts of toxic chemicals in the healthcare setting wherein volunteer nurses wore silicone wristbands for a few days and will be tested to assess what are the risks and environmental exposure of nurses in the healthcare settings. At the same time, we have an upcoming case study entitled Safe Care, Safer Materials, wherein we will be testing two products in the health sector or the hospital setting, an IV fluid bottle, and even a surgical gown to assess what are the toxic chemicals present and how much is present in those products. So this is in alignment to what we are showcasing that how are we exposed to the toxic chemicals of plastic product. Now, so ultimately, our prescription, our instruction, the Signa for the Signa webinar is one planet, one health, and a prescription to address plastic pollution. Now, in relation to our cause to the Global Plastics Treaty, we want a consistent precautionary health protective approach, which is essential to reduce plastic pollution and safeguard human health. Given that the health sector's purchasing power is approximately 10 to 11% of our national GDP, and plastic accounts to significant share of this expenditure. And we are encouraging for the hospitals to implement policies to phase out the most harmful plastic products and chemicals of concern, which is a cornerstone for us to address plastic pollution. In addition, with us doing this prescription, workers, the hospital staff, and the community also have the right to be informed and also be informed of the exposure that they are in with the plastic products that we are using in the hospital setting. Additionally, we also encourage everyone to ask your government for mechanisms to control plastic supply and reduce production um, for this to happen and address plastic pollution, and also to identify and phase out the most harmful chemical exposure to protect health and the environment. So ultimately, we want to establish a binding obligations to prevent health impacts from plastics and uphold environmental rights and ensure a safe and healthy environment. So the ideas and even the presentation has showcased us that there is no single actor that can address plastic pollution alone. Healthcare institution, GGHH members, policymakers, healthcare waste management teams, civil society are all have a role in preventing plastic pollution and its harm across the life cycle. So on behalf of Healthcare Without Harm Southeast Asia, our speakers, thank you to Stacia, to Kyla, Murillo, and our team, and all the participants for joining us across all region for this webinar. Please continue the conversation by sharing your actions that can other healthcare institutions can apply as a prescription to address plastic pollution. Thank you, everyone, and have a good morning, good evening, and good day wherever you are joining us. Thank you, everyone. Bye.
Doc, no group photo. We're good.
Oh, yes. Yes, group photo, please. Sorry, everyone. Let's open our cameras. Who will take the photo?
I can take the photo, Doc Mitch. Okay,
Thank you,
everyone.
Rally.
Okay. So I'll take the photo in 3, 2, 1. Okay, I have 2 windows here. So next window, 1, 2, 3. All right. We're good, Doc
Thank you,
Mitch.
everyone. Bye po.
Thank you, everyone. Salamat po.